If you're helping your loved one figure out Medicare, you've probably stared at your screen wondering which one is actually better, Original Medicare or Medicare Advantage. Plot twist, there's no universal answer. It depends on your family situation. But here's what you actually need to know. Original Medicare Parts A and B, run by the federal government. Part A handles hospital stays, skilled nursing facilities, hospice, and some home health care. Part B covers doctor visits, outpatient care, preventative stuff, and equipment like walkers and wheelchairs. The catch? It doesn't cover most prescriptions. You need to add a separate Part D plan for that. Medicare Advantage is run by private insurance companies contracted with the government. They have to cover everything Original Medicare does, but most throw in extras not covered by Original Medicare, like prescription coverage, routine dental, vision, and hearing care. Now you're probably asking how much does all of this cost? Original Medicare Part A is usually free if your loved one or their spouse worked and paid Medicare taxes for at least 10 years. But if they end up in the hospital, there is a $1,736 deductible per benefit period. Part B costs almost $203 per month, and after the annual deductible of $283 is met, Medicare covers 80% and your loved one pays 20%. Medicare Advantage, same $203 Part B premium, plus an average of $17 per month for the plan. It sounds cheaper until you read the fine print. Original Medicare lets your loved one see any doctor in the country who accepts Medicare. No networks, no referrals. And for home health care, Original Medicare covers it for as long as it's medically necessary. No copays, no arbitrary limits. Medicare Advantage is more like your typical PPO or HMO. You're limited to home health providers within your network. You need prior authorizations. You need referrals. And while they have to cover home health, many plans cap visits or cut services short, meaning you're picking up the slack when professional care gets yanked away. Now, there's a lot to consider when making this decision, like supplemental Medigap plans, out-of-pocket caps, and enrollment windows. We broke it all down in this blog post because we know you don't have an infinite amount of free time to research it all. Read it at the link in the post caption.